The FDA is warning patients and doctors to make sure that their Ozempic prescriptions are legitimate after several hundred units of a counterfeit version were seized in the U.S. Novo Nordis, the maker of the diabetes drug, first informed the health agency about the issue earlier this month. NBC News medical analyst Dr. Vin Gupta joins us now with the details. Dr. Gupta, where in the United States is the FDA saying these counterfeit versions were found, and have there been any health issues connected to it?
Well, Ellison, the distribution of this, the size and the scope of it, we're still trying to get a better sense of. And I think we have a full screen to show all our viewers the lot number on the actual packaging of these counterfeit medications. And so you want to make sure that if you have Ozempic at home, that it doesn't in any way track to one of these numbers here, these lot numbers that then correspond to counterfeit products. And frankly, the concern here from the FDA standpoint is we don't know what's in these specific formulations. We don't know if this could be causing adverse events. There are 6 reported adverse events linked to these counterfeit products. We don't know if that's because there's something different in these formulations, but that's the concern.
How long do people need to keep checking these lot numbers to make sure their medication is actually real? And if, say, you look and you're like, oh, my goodness, I think I had a counterfeit one, what should you do from here?
Well, if you have a counterfeit one, you should absolutely throw it away. Speak to your medical provider, especially if you've been having any symptoms. I would say that this is vigilance is required for at least 2 months, just to make sure. That's usually how long it takes to get some of the supply out of circulation. So 2 months, 1 month for just anybody that has it. Usually it's a month supply that gets dispensed, and then an additional month just to be sure. So that would be the recommendation.
Okay, and really quick before we let you go, so what are the specific side effects of possibly using the counterfeit drug that people should look out for?
Usually what we've been seeing reported is stomach problems, but that's typically, that can be associated with normal versions, regulated versions of Ozempic. So it's hard to really disintermediate here, Ellison, but usually what we've been seeing here are gastrointestinal side effects. So that's something to keep an eye out for.
Dr. Vin Gupta, thank you.
Thank you.
Later this hour,